everyone. We have our patient here who's never had OMM before. Very special day. Woo! OMM 2025. All right, so if you want to just tell us your name and why you're seeking some treatment today.
Yeah, Chelsea Hoffman. I got to meet Dr. Alex King last night, and he was telling me about the OMM method, and I am a true believer in holistic medicine. I work for the American College of Lifestyle Medicine, so I'm excited
So you're
to
paid to say that? No, I'm just
experience
kidding.
this. Yeah.
No, so yeah, we were talking at we were at dinner for the AYA, and I was like, wait, have you guys had treatment before? And they have not. So I'm like, well, here you go. So tell me about what you're feeling. Is it from the plane ride? Is it just like old injuries, anything like that? New injuries?
So I don't have any injuries, but I do strength train regularly 3 to 5 days a week. And so I feel like just from lifting weights, I don't stretch properly or as much as I should for like recovery. And recently I did something where I just injured my back and was like in severe pain for like a week.
How long ago was this?
Oh man, probably like 3 months ago.
3 months ago? Have you fully recovered or not quite?
Fully recovered.
Okay,
I feel great now, but I feel like my hips are super tight, and I notice that flares up back pain.
Sure, absolutely. So we'll take a look into that. Any old traumas, falls, like major accidents, car accidents, whiplash, nothing like that?
Nope.
Did you play sports when you were younger? Any physical stuff?
Danced competitively,
Okay.
but
So
no injuries.
I'll be checking for any hypermobility because a lot of dancers and gymnasts have some components. Okay. Any surgeries or anything? No fusions or anything like that? All right. So lie on your back. C-section. That's actually good to know. And I'll talk about why. So if you want to lie on your back, was it one C-section?
Just one, yes.
Just one. And then you can bend your knees, lift your hips into a bridge, and back down. That just kind of resets everything.
Oh, okay.
I'm just going to take this thing off. So why I mentioned C-sections real quick is they can often affect the way your hip flexors work, right? It's a deep incision.
Yep.
It is not a little surgery, or it's a major thing. So over time, that scar can actually cause a lot of imbalances, especially with hip flexors and your low back, and just maybe a little bit of prone towards tension, right? Like you were talking about. So I always start at the feet and like work my way up, like I told you guys about. Check here. So right away, when I pick her lower leg off, there's a little hyperextension here. And so what I'm starting to think about is if she's hypermobile, her muscles are working extra hard to be stable and to be ligaments. So I would give you like a 4 out of 10 on the hypermobility scale. So not like full-blown EDS syndrome, but you are a little extra flexible. So checking hips. You are a little off. Do you feel like you're walking sideways at all?
Yeah.
So what is it? It's a little interesting. She has a left anterior innominate. Normally people have a right anterior innominate. Are you left-handed? Right-handed? Okay.
Right-handed.
Right-handed. Do you drive manual or automatic?
Automatic.
Okay.
I had to think about that for a second.
So my theory might not be right. So I think a lot of people have this anterior right innominate, or your right hip bone is rotated forwards more because everyone drives with their right leg. But you have something unique. So any pain here?
No, that feels
just
good.
A stretch, yeah. So what I can tell is your glutes are very tight, so we got to stretch those out. It's called muscle energy. So push towards me. 3, 2, 1, and relax. And then push again. Relax. And again. And relax. So every time I ask you to contract that muscle, right after that contraction, it has a greater ability to relax. So I can get you into further range of motion with that. And so let's see here. You also have a pelvic side shift totally to the right by about an inch.
Wow.
So like that much. So we'll fix that too. And then I'm going to check some hip flexor. Is that pretty sore, tender? No? Good. All right, let's check the other side. So your psoas, you ever hear of the psoas? Pesky little bugger. How is that? More tender, yeah? So this psoas could be causing a little bit of a pelvic side shift. So let's treat it out. Push towards me with your knee. 3, 2, and relax. Doing okay?
Yeah.
Push. 3, 2, and relax. One more time. Push, 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 and relax. And then check this glute. Also tight. Push towards me. 3, 2, and relax. And push again. Relax. One more time. And good. So this might be a little tender. I'm going to do a release for your psoas, okay? So I bring the leg into flexion and just find a little bit of that. Yeah. So I want you to take some deep breaths. Really deep, deepest all day. And then I want you to try to drive your knee, your left knee, towards your nose. Yeah. Yeah, I know. And then relax. And actually do that against resistance. So do that, but like half as much. Yeah, perfect. And then relax. Good. So we're using that post-isometric relaxation effect. Good. And then relax. Okay. And then just try to breathe. I'm just going to move this around. Okay?
Mm-hmm.
You might feel some radiating stuff in the belly.
Actually feels good.
I know, because we released it and you're getting towards even. Any digestive issues? Nothing. Good. Take a deep breath. Okay. Exhalation on the right, inhaled on the left. So your rib cage is like a little bit torqued.
Weird.
And this also might be a little tender. You okay?
Yeah.
So take a deep breath in. So I'm doing a diaphragm release. And then relax. Yeah. So she has a left hemidiaphragm restriction. Deep breath in and relax. I feel the heartbeat in her belly.
Me too.
Abdominal aorta. So I'm doing a diaphragm release on this side. And then deep breath in. Good. And relax. So what's interesting is like every DO who does OMT has their own style based on who they learn from. I equate it more to like a martial art form than like, just writing a dose or a script. So, it's like everyone treats a little differently. I treat pretty direct. I do a lot of indirect, meaning like going right into the barrier. Indirect, you're more kind of going with the ease of positioning. Okay? Good. And then I want to have you lie on your side facing me, left side. There we go. And then scooch a little towards me. Yep, perfect. I'm going to slide this arm a little bit there. And then here.
Ooh.
Boom. So we got an articulation there. People say it's a crack, right? But I didn't even try. I just let the body do it. There we go again.
Yeah.
I wish the mic was back here.
I know.
It's like click, click, click. Snap, crackle, pop. Gently try to bring your hip backwards against. Yeah. 3, 2, and relax. There's Dr. Powell. This guy's one of my mentors, Dr. Lenny Powell. And bring your hip backwards. And relax. Have fun. I'll be there soon. Good. One more. 3, 2, and relax. Let's do the other side. You okay?
Oh, yeah.
She's like, oh, I needed that.
That felt amazing.
Oh, my God. And scooch again a little bit. Yep, perfect. It's funny because after you get a lot of treatments, you already know what to do. So, like, patients are, like, just as good. I'm like, you can treat yourself. They're like, no, you still got to do that. There we go. We got another. Hip back. 3, 2, and relax. Good. And again. And relax. Ooh. And again, you want to come around to this side? You can see. And relax. So you guys see how I'm rotating and side bending the spine just to open up these joints here? Because we have little joints along the spine that get compressed. And unless you open them, they kind of stay locked up. Good. And then lie on your back again. You good?
Good.
All right.
That was amazing.
And we reassess. Wait, what was that? I didn't hear you.
That was amazing.
Checks in the mail. There's the guy who taught me always said that. His patients were like, oh, that was so good. He's like, here's my Venmo. So checking some foot arch. How long was your plane ride?
About an hour.
Okay. Not terrible.
No.
Still just enough, though, to get your compression in the spine. So now that side shift is gone. Congratulations.
Yes. Thank you.
Yes. All right. And then we're going to go check the upper half. So we kind of made it up to here. I've untangled half of the headphone cord. That's been all tangled up. And now I'm going to slide my hand under, and you can just flop like a fish. Good. I know. So she's got a lot of thoracic hypertonicity, meaning your upper back is really tight. So I'm working along the rib angles. Yeah,
A ticklish.
I know. So what's interesting is being ticklish is actually can be a pain equivalent.
Oh.
So that hypersensitive tissue has been chronically active or just tight all the time,
Yeah,
right?
that makes sense.
So when I get to a spot that's kind of ticklish, of course I don't go and just like tickle someone, but I work on that area and then just try to take some deep breaths. Good. Okay, and it's starting to release. You okay? So she has like this band of like taut tissue going down her spine, the paraspinal muscle can follow it, right? You feel that all the way to the lumbar spine. So for a case like yours, I would probably use some acupuncture as well to get these kind of dry needled in a way. And we're just releasing. There are a lot of nerves under this area, right? This sympathetic chain ganglia, which is a long ganglia that turns on when your fight or flight is on. So getting these rib angles to loosen will actually decrease that fight or flight. And yeah, that's why she's floating off in space right now. All right, we'll do the other side. You okay? If only we had like an eye mask.
Oh my gosh,
Because these lights are very bright. I'm light sensitive. That's why I wear a hat. It's not because they say cool things. It's because I like the lights. I like it to be dim. Yeah. Like if someone's doing OMM on me, I just kind of like do this. And so like, good night. Go to sleep. Yeah, that's fun, huh? Trapezius, traps, a lot of tight muscle up here. If you want to come here, you can see what my hands are kind of working on, right? So this is a technique I learned from my mentor, Dr. Hartman. You get your thumb in the trap here. My fingers are wrapped around her scapula, her shoulder blade. And I'm literally just doing this kind of rocking motion. Very simple. We call it rib raising, maybe slightly modified. This is like what those massage chairs do, but 10 times better because my hands generate a lot more heat than that. And we keep working. And until chairs get AI, I think I have a secure job, you know? Oh, there we go. So you've got a lot of hypersensitivity along T8 to 12, even a little bit on L1. You do a lot of like rows, back work, deadlifts. Oh, fun stuff. I messed myself up deadlifting when I was like 19. Still learning from that injury. Be careful, folks. You deadlift with barbell, dumbbells. Nice. I did a little workout this morning. Woke up way too early. Like, you know what? I should probably move my body around.
Always a good choice.
Yeah. Oh, yeah. The endorphins get flowing and just having a good day already. There you go. You okay? Okay. Now we're going to go up to the neck and the cranium. I just moved this thing with no wheels. Okay. Okay. So I'm going to check the cervical spine, kind of spraying up and down, and just test some range of motion. Okay. Da-da-da-da. And da-da-da-da. Okay. Do you get headaches? Good. No migraines, no TMJ dysfunction.
Nope.
You're lucky. Like half the people out there got these things. So I get a little bit of tension under here. Let's see. Side bending. Side bending. Okay, so a little more restricted here. Do this guy. You okay? So try to gently push your head to the left. 3, 2, 1. Relax. Good. Do that again. Relax. One more. Yeah, good. Okie dokie. And then to the right. Yeah. Relax. And again. And relax. One more. Good. Okay. Okay, so this technique is what gives me job security. I go on the paraspinal cervical muscle and we just do some soft tissue work. Feel some guitar strings here, piano strings. We just play them. Doing okay?
Mm-hmm.
It's a good hurt, right?
Yeah, it feels amazing.
People are like, I didn't even know that was there. I'm like, I did. It's right on our fingertips. So you've got a little bit more tight tissues on the right side, which makes sense, right? A lot of right-handed people. And that going up to the neck. Yeah. Okay. Let's do the left side. And then we're here. Da, 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 da. Are you on a beach right now?
I am.
Which one?
Lake Michigan.
I want to go. You ever been to Ibiza?
No. Ever been to Lake Michigan?
No.
It's beautiful.
Yeah? Okay. I like lakes. You have a boat?
No, I wish I did.
Yeah. That's a lot of maintenance. You can always rent a boat, right?
Yes.
My grandpa had a boat, Eastern Shore, Maryland.
Oh, that sounds so nice.
I would get really seasick.
Mm-hmm.
So other than that, it's great. So now I'm checking her cranium. You know, can't forget to treat the head because your brain's important. Kind of does everything. So with cranial work, it's kind of like watching paint dry, watching grass grow. Not super. Thanks, man. It's not very exciting to watch, but it's pretty exciting to treat with it. So what I'm trying to feel is the flow of cerebral spinal fluid. It's called the craniorhythmic impulse. It's very important. It's the inner flow of your central nervous system. Some people it's very locked up, especially chronically ill people, people with migraines, even people who have depression. Luckily for her, it's flowing pretty good. So what I do is I'm just kind of a witness to it, and it kind of treats itself, which is really nice. It's like forgetting Sarah Marshall when he's teaching him how to surf, and he's like, "You're doing too much, man. You just chill, and you just." And then he doesn't even get up. He's like, "Well, you got to do a little more than that." So it's this dance between kind of watching it, maybe nudging it a little bit, but not like overpowering it because then it'll run away. Very difficult to teach students because med students, they're all very smart and they all want to do too much. I'm like, no, you just gotta relax. Like, see those trees out there? Just look at those trees. How pretty are those trees? Look at the sun. That's nice. Oh, she's treating herself. Cool. Things shifted. And then cranial vault hold, just get my bearings. Of course, I have to have good posture with this, so I don't want to impart poor mechanics onto the mechanism, we call it. So a little bit of a right torsion. I think of cranial work as like a Rubik's Cube. You got to find the pattern. Everyone's a little different. There's things stacked and stacked and stacked on each other. Because we've all fallen off the monkey bars and the seesaw and, tried to learn snowboarding and banged up your tailbone and life happens, right? Have kids. That's always fun. There we go. Healed. Any words
That
for
was
our
amazing.
audience?
Thank you. Highly
Of
recommend.
Thanks, everyone.